Wonderful. Well, welcome everyone. Welcome to our webinar on youth action on climate, water, and neglected tropical diseases, or NTDs. I'm Alison Krentel. I am the chair of the steering group for the Canadian Network for NTDs, and I'm an associate professor at the University of Ottawa in the School of Epidemiology and Public Health, and a scientist at the Bria Research Institute. As we begin today, I'm speaking to you from Ottawa, where we pay respect to the Algonquin people, who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We honor all Indigenous people in and around Ottawa and around the world, from all nations across Canada. So this webinar, in partnership with the Canadian Association for Global Health, Climate Change and Health Working Group, follows some very exciting developments in climate and health. Canada endorsed the Kigali Declaration on Neglected Tropical Diseases in 2022 and backed this commitment with funding in 2023 for trachoma elimination in the Americas. In 2023, COP28 welcomed its first Health Day, which resulted in commitments from partners globally through the Reaching the Last Mile Fund, which raised a staggering $777 million to address water and vector-borne diseases in communities facing the greatest climate and health risks. This year at the World Health Assembly 77, the first ever climate and health resolution was agreed. And the G7 Leaders Summit this month, commitments were reaffirmed supporting climate resilient health systems, eliminating NTDs as a public health problem, and reaching the last mile communities as essential for achieving global health equity and universal health coverage. So it's a very timely session that we're having today, and I'm looking forward to the content. So as we get started, we're going to begin with a short video that was created by Uniting to Combat Neglected Tropical Diseases on climate and NTDs ahead of the Reaching the Last Mile Forum at COP28 last year. Following this video, I will pass the microphone over to Ali Al-Ansari, who is a Master's of Public Health candidate at Queen's University and an intern with CAGH, and he will be our moderator for today's session. So we'll start with the video, and then I'll pass over to Ali. Thank you very much.
Hello, everyone. Thank you, Allison, for a great opening to our session. We are pleased to host two very dynamic speakers on youth action on climate, water, and NTDs, Hooria Amiri and Aisha Barkat. Some housekeeping before we started with the presentations. Please hold your questions until the open Q&A session, or you could feel free to put your questions in the chat box and we will get to them when we reach the Q&A session. And please keep your microphones on mute so that we can all hear the speakers. Okay, starting off, our first speaker is Hooria Amiri. Hooria is the co-founder of C.A.N 1.5C. She's an award-winning storyteller, creating documentaries to advocate for NTDs and climate issues. In recognition of her work, she's also listed as a global health leader for eliminating NTDs.
Hello,
Hello, Hooria, how are you?
I'm doing great. How are you?
Oh, very good, thank you.
Am I audible to everyone? First of all, thank you so much to the Canadian Association for organizing this webinar on this crucial intersection. Indeed, youth has a major role to play in the global health landscape. Today, in this presentation, I'll be discussing majorly about what are the challenges in this landscape and how we as youth can solve these challenges majorly through advocacy. Before starting, I would just want to know how many of you have heard about neglected tropical diseases before? If you are having an idea of what NTDs are, just kindly raise your hand so I can get a rough idea. Okay. There are a few people who have raised their hands. Okay. Yeah. So for those who don't know, just move to the next slide. Yeah. For those who don't know what neglected tropical diseases actually are, NTDs or neglected tropical diseases are a diverse group of tropical infections that majorly affect the most poorest part of the world. There are a group of 21 communicable diseases that are both preventable and curable, but still they affect more than 1 billion people from all across the globe. The thing is that why they're called neglected. In the global landscape, even though they have a huge impact, they're not given that priority. Therefore, they are termed as neglected tropical diseases. The thing to understand here is that neglected tropical diseases itself is not an isolated issue, but is interconnected with some of the most diverse sectors. I've mentioned 5 of them here that are climate, wash, gender, and others. I'm personally working on the cross-section of climate change and neglected tropical diseases, and we'll delve deeper into that. Ali, can we move to the next slide? Okay, so before starting what this cross-section actually is, I would like to share a personal story of mine. I'm from Pakistan, a country that is most vulnerable to climate change and its impacts. In 2022, in the monsoon seasons, Pakistan faced extreme flooding. It was a havoc across the country. Literally 1/3 of the country was underwater. The crops, the lands, the houses were all destroyed and were all reduced to rubble. It was stated that it's a third-level national emergency. Obviously, at that time, all the international NGOs, groups, local community members, all were working to reduce the impacts of the flooding and the climate change. But what we all neglected at that time was the health impacts of climate change. After a few weeks of flooding, when the water started subsiding, the grounds which were holding the stagnant water, due to hot temperature and wet grounds, these conditions became the perfect breeding ground for mosquitoes. At that time, Pakistan faced a severe surge in dengue cases. And according to a report by WHO, Pakistan faced 900% increase in dengue cases just in the month of September after flooding. The pictures that you are seeing here are from one of my documentary, Disaster and Diseases, the Double Impact of Climate Change. I was working at that time on the grounds. And I was in communication with a doctor at that time, and he was telling me that they are not even having proper resources. They are not even having enough beds to accommodate the patients, because at that time, the numbers were really raising high. Almost 150 to 200 cases of dengue were being reported on a daily basis in Pakistan. And for those who don't know, dengue is also a neglected tropical disease. So this story basically summarizes how climate change accelerates neglected tropical diseases. Ali, can we move to the next slide? So for today, in this cross section, there are three major things that we need to understand to actually understand how climate change is affecting neglected tropical diseases. First of all is temperature and rainfall patterns. We know that due to human activity, we are contributing to global warming. And we all are facing extreme weather conditions globally, whether it's droughts or abnormal rainfall patterns. Mosquitoes and other vectors, they breed in those areas that are damp and are hot. So after flooding or after these abnormal rainfalls, these wet grounds become perfect breeding ground for mosquitoes, and hence these conditions accelerate the breeding of these vectors, ultimately contributing to spreading of neglected tropical diseases. The next thing that we have is food security. Obviously, when these these catastrophes occur in the regions, people don't have enough food or proper water, clean water to drink, and these conditions ultimately affect their immunity. And due to the poor immunity at that time, they're more prone to these deadly diseases. Next up, what we have is let me see. Yeah. Next up, what we have is human migration. Obviously, when these catastrophes occur, people tend to move to other areas within the country, whether it's from one village to another village, from one city to another city. When these people migrate, sometimes they're carrying diseases with them. And obviously, neglected tropical diseases are communicable diseases that are spread from one person to another. So in this way, climate change ultimately is contributing to the spreading of neglected tropical diseases and is accelerating the impacts of neglected tropical diseases. Till now, I believe that you all might be thinking that this is a huge cross section and this is an important cross section, but I would like to tell you all that this cross section is still neglected. Not much attention is still given to this. Ali, can we move to the next slide? Still, there are a really few percentage of climate policies that effectively address the impacts of climate change on us. But here's what we can do. This is now our responsibility. This is the time where we, the youth, have to enter the chat. We should take a responsibility to advocate for this cross section and to end this neglect, because advocacy begins with that. Ali, can we move to the next slide? I've listed three basic things if you want to start your advocacy journey. Now, obviously, all of you who are present in the webinar, if you were not aware of this cross section before, now you have a general idea of what the problem actually is. And now you all can contribute to advocating for this cross section in your communities, in your circles. How you can become an advocate and how you can start your advocacy journey. First of all, social media. Social media is indeed one of the most potential tools that we are having today. We have already seen some successful campaigns from young people. Whether it's Fridays for Future, or we have also seen Black Lives Matter campaign. These campaigns created a momentum globally to advocate for the issues. We can also harness the power of social media to advocate people from all across the world about this cross section. But now the thing is that not everyone is present on social media, obviously, especially those marginalized communities that are facing the first-hand impacts of climate change and neglected tropical diseases. They are not using TikTok, they're not using Instagram or Facebook, they're not present on the internet. for them, to educate them, it is important that we, the youngster, we all engage with the community members. We all start advocating in our communities. It is really essential to educate the people so that if these catastrophes occur, they know what are the next steps and they know how they can mitigate with these challenges. Third of all, we have storytelling, one of the potential tools and one of my favorites, because you know what, advocacy is not just about speaking about the issue. It is about creatively telling the people what the issues are and making the issues more understandable and more easier. Storytelling can take various forms. It can be the form of music, it can be in the form of art, the form of text, or anything. And when you tell your personal stories, people tend to connect with that more. So these are some of the most simplest ways that you can start your advocacy journey and can contribute to advocating this cross section. But now this is the basic part. We have to ensure that our advocacy reaches the top part. And for that, we have to influence policy making. Look, we, the younger generation, we will be the ones who will be living in the decisions that are made today. So we should be the ones present on the decision-making table, taking necessary action for our collective future. For this thing, it is important that we, the younger generation, should demand our place at the decision-making table and should engage ourselves in the policy advocacy. I've enlisted 3 of the most basic steps through which we can start this. First of all, by engaging with local government. We all have our community focal persons or local government members. Engage with them, discuss with them about the cross-section, craft some campaigns for your community-based campaigns to advocate for this cross-section, to educate people and to empower them at this nexus. Next up, international youth forums. We are already witnessing the growing impact of younger generation in major global forums and major international forums, including like COP, etc. When we're speaking at the forums, we have to take this responsibility to give NTDs the center stage that they deserve in all these discussions. When youth is representing at the international forums, it is our responsibility to engage with stakeholders and address this cross-section. Third of all, collaborating with international NGOs. It's also a responsibility of international NGOs, of big NGOs, to dedicate some positions for the youngsters so that their voices can be represented. Collaborating with these international NGOs that are already having some connections with the stakeholders, with the policy makers, we can actually make sure that our advocacy is reaching the top level and we can ensure that our advocacy can influence policy making. Ali, can we move to the next slide? For those who are, hearing about this for the very first time, I believe this cross-section is really complex. One way that you can understand this and you can educate the people about this is One Health approach. One Health basically means that the health of environment, of people, and of animals are all interconnected. Understanding this fact, we can actually, in an easy way, we can address the cross sections of climate change and of environment and their impacts on human health and on the spread of mosquitoes. This is actually a really detailed topic, but if you really want to know, you can search about it. Ali, can we move to the next slide? Yeah. So these are some of the most simplest things that we can adopt and that we can include in our advocacy to ensure that we are giving NTDs the center stage that they deserve in these global discussions, whether we are discussing about climate change or neglected tropical diseases, or we are discussing about climate change or WASH or poverty or gender. Include neglected tropical diseases as an integral part of the puzzle. By building on this momentum and everyone, it's our responsibility. If every one of us start playing our part in our community and beyond, we can actually become the generation to end neglected tropical diseases in our lifetime, or we can say that the generation to end this neglect at least. So these were some of the basic things that you can include in your advocacy to ensure that you are properly, advocating for this nexus that has been neglected for so long? Back to you, Ali.
Thank you so much, Hooria, for your presentation. It is very appreciated. Moving on onto our second speaker, it's Aisha Barkat. Aisha is a PhD candidate in interdisciplinary global health at McMaster University. She also holds a bachelor's degree in biochemistry, microbiology, and immunology, and a master's degree in epidemiology and public health from the University of Ottawa. Aisha's research is centered around the ecological, biological, and social determinants of dengue virus transmission in both Latin America and the Caribbean. Aisha has previously held positions with Canada's IDRC and Public Health Agency of Canada, among others. This year, Aisha is rallying Canadian youth towards achieving their shared goals as the Canadian Youth Delegate to the World Health Assembly and Pan American Health Organization Directing Council. So moving on to Aisha.
Thank you so much for that lovely introduction, Ali, and thank you, Hooria, for that amazing presentation. I'm gonna go ahead and share my screen, and I hope everybody can see. Okay, wonderful. Hi, everyone. My name is Aisha. I'm a PhD candidate in global health. All right. So I was just saying that dengue is classified as one of the 20 or so NTDs cataloged by WHO, and today it's found in over 100 countries and territories around the world. As many as 60% of all global dengue cases come from the Americas region, where it's endemic. And I think it's important to understand that dengue transmission functions like most NTDs in an epidemiological system or an episystem. And so here, the episystem refers to the system of factors that influence the epidemiological components of diseases. And so to really elucidate episystems, what we need are multi-level analyses for climate-sensitive problems like dengue. Are we still okay with the audio? I'm just going to keep going until I hear someone come in. Okay, wonderful. And so there's the problem. How can we elucidate the dengue virus episystem to understand the relationship between climate change and dengue epidemiological indices to ultimately initiate sustainable vector control and dengue prevention campaigns? And I think to do this, what we need to do is to identify, conceptualize, and then investigate all the factors involved in the dengue episystem, and then mobilize knowledge to inform dengue prevention and control policies and programs. And if we're able to do this, then perhaps dengue can serve as the model for dengue can serve as a template for other NTD prevention and control initiatives. And this is the backbone of the research that I do. And so I've already started on solving the problem by identifying and conceptualizing the factors determining dengue transmission. I've categorized these factors as being either ecological, biological, or social to create what I call an eco-biosocial conceptual framework. And so this framework was built with experts who researched dengue from across Latin America, who corroborated these factors and then contributed to a research and a policy agenda for dengue prevention and control. So once I did this, I headed to the field to really start my investigation. So out of all of the Americas region, dengue is most burdensome in Brazil, where it's representing a very significant public health challenge. And this is because Brazil offers a very unique and favorable environment for dengue transmission, such as high temperatures and high air humidity. And megacities like Sao Paulo are potential hotspots for dengue transmission. Poverty pockets in big urban cities really increase the risk of being exposed to mosquitoes where water, sanitation, and hygiene practices are poor. For instance, water storing practices in Latin America are common when pipe water supply is not continuous. And so mosquito vectors that carry dengue and other NTDs like chikungunya virus are able to breed and lay eggs in water storing containers within and around human homes. And so I visited Sao Paulo last month, just a month after an unprecedented dengue outbreak caused an emergency in the Sao Paulo state. And the objective of my research project was to really investigate the knowledge, attitudes, and practices of climate change and dengue among residents of urban Sao Paulo. And while I was there, I learned that the implementation of control and prevention measures for dengue remains a challenge, and there's no effective treatment available. And although vaccination is just starting out, this has proven to be a really huge logistical and administrative challenge and burden. And so vector control remains the most important method to prevent dengue, but it's not the only method. And strategic interventions, when they're combined and delivered simultaneously in an integrated way, they can really curb NTD morbidity and mortality. For instance, community engagement is often a key strategy to the success of NTDs prevention. These interventions empower communities by promoting their awareness about NTDs. And when people know about how NTDs spread and and if they can identify the factors involved in the episystems, they can intentionally prevent themselves from being exposed to disease vectors. Knowledge mobilization is another intervention, particularly relevant for researchers like myself. I think we need to make our research findings more accessible to general audiences and just be more mindful about the populations that we intend to impact to really bridge the gap between science and policy. Networking and capacity building can mean investing in training our healthcare workers to really strengthen service delivery through primary healthcare and through immunization programs, and monitoring and evaluation of our progress towards achieving sustainable targets helps us really hold ourselves accountable. And so systematically integrating these interventions, among others, including interventions outside of the health sector, such as education, WASH, gender and social inclusion, and agriculture, is really necessary for the elimination of NTDs. So the success of NTD prevention programs will really be defined by the extent to which their objectives meet stakeholder expectations and needs. So these stakeholders can include international organizations like the WHO, national governments and their ministries of health, ministries of environment and education, non-government actors like NGOs and advocacy groups, research institutions and funding agencies, the media, journalists, and most importantly, the community members. And these community members will need to be involved every step of the way. And one particular group of the community that is really integral to the success of NTDs prevention is the youth. And youth represent a very significant proportion of the global population, particularly and coincidentally in areas affected by both climate change and NTDs. But despite this, youth have little say over the decisions that shape their present and their futures. And this year, I'm representing Canadians as Canadian Youth Delegate to the World Health Assembly, which took place a few weeks ago, and to the Pan American Health Organization Directing Council, which will be held in October. And so far in this role, I've learned that young people bring fresh perspectives, innovative ideas, and often a sense of urgency to addressing climate change and NTDs. And that by involving youth in decision-making activities, governments can really harness their energy and creativity to develop more sustainable and inclusive solutions. But what does this mean for Canada and for Canadians? You may be thinking, why do I care about what's going on with dengue in Brazil? But NTDs pose a significant public health challenge globally, and that does not exclude Canada. Canada is one of the top 10 countries most vulnerable to a changing climate. And as the world gets warmer, Canada will be a more viable place for dengue mosquito vector to survive. And so by 2080, if all climate indicators remain the same, the Aedes aegypti vector and dengue will be among us in southern Ontario. And so this is why Canadians in Canada should act now for prevention, generating interest and support from the general public, advocating for the elimination of NTDs as a key priority, a global health priority for Canada, and investing in integrating interventions for NTDs prevention and climate change mitigation and adaptation, and finally using a health equity lens to really ensure that no one is left behind. And so if there's anything I want you to take away from today's talk, it's that firstly, climate change is a determining factor in NTD's epidemiological systems. Second, to really ensure a multi-sectoral response to NTD's prevention, leadership and governance of the health systems at all levels should really include NTDs in an integrated way. And third and finally, youth can act as an effective change agent and advocate in achieving ecologically sound, locally appropriate, and sustainable strategies for NTDs prevention. Awesome. Thanks so much.
Thank you so much, Aisha, for your presentation. Moving on, I want to thank Aisha and Hooria for your excellent presentations. Before we move on to the audience Q&A, we have a moderated panel, and I have a few questions for both Hooria and Aisha. So first off, Aisha, having represented Canadian youth across Canada at the World Health Assembly earlier this month, what stood out for you in terms of areas of work that Canada should support that would ensure access to clean water and sanitation and the impact of climate change on health?
Yeah, thanks so much for that question, Ali. Like you mentioned, I did have the pleasure of participating at the World Health Assembly in Geneva as an advisor to the Canadian delegation. Representing youth at the WHA provided a really unique experience and perspective on global health issues, particularly regarding access to clean water and sanitation. As you may know, the 6th Sustainable Development Goal is to ensure availability and sustainable management of water and sanitation for everyone. And as we work towards achieving this goal by 2030, I think Canada really needs to consider in investing in infrastructure here at home, particularly among rural, northern, and Indigenous communities to ensure access to clean water and sanitation facilities. I think Canada can also increase commitment at the international level for international development aid focused on water and sanitation projects in developing countries as well. Regarding the impacts of climate change and health, I had the pleasure of providing an intervention for the climate change, pollution, and health agenda item in Committee B. So essentially, an intervention is when a member state delegate raises their name tag and provides a statement in the committee room on behalf of their state. And so for my intervention, I prepared a short 2-minute statement on the importance of emphasizing the urgent need for collective action to protect human health, biodiversity, and our planet, and really highlighted the role that youth have played and will continue to play in the climate crisis. And gratefully, all member states were on the same page, and the WHO recognized climate change as an imminent threat to global health, passing the resolution, which was a real win. And I think that maybe on this front, Canada needs to invest in climate resilient health systems that can really withstand extreme weather events like this heat right now in Ottawa, as well as the looming threat of NTDs. And Canada should really prioritize our healthcare professionals and provide them with the right training, the right resources, and the right mental health support to have them face the climate crisis and the stress that comes with that. And also there's a need for more robust surveillance systems for monitoring and reporting on climate-related health risks to inform policy and response strategies.
Thank you so much, Aisha, for your efforts. And I also hope that your voice was heard in the assembly. And I agree with you, infrastructure is an essential part to flourish in the future in such for such a important disease, for an important disease. Okay, moving on. Hooria, you've been mobilizing young people to engage in climate action through C.A.N 1.5. What have been some of your achievements with launching this new initiative?
Thank you so much, Ali, for this question. My new initiative that I've co-founded, C.A.N 1.5 for Climate Action NTDs, was launched on 1st of January 2024. With a vision that climate action and neglected tropical diseases are not isolated issues, but are interconnected. We are on a global mission to advocate for this cross-section that has been neglected for so long. In less than 6 months, we've collaborated with international and national NGOs, with local governments, and now we're strong with more than 500 advocates that we like to call our C.A.N advocates. Young people who are mobilizing efforts to tackle climate change and neglected tropical diseases from all across the world. During our advocacy, we've recognized that most of the advocacy material that we are having is in English. That is obviously an international language, and it's not understood by many, especially those who are facing the direct impacts of climate change and NTDs by the marginalized communities. So to mitigate this gap, we launched our Dialects of Change program, in which till now we have advocated in more than 14 local and international languages across Nigeria and Pakistan. One of the other successful projects that is really close to me as well is our C.A.N project. We've partnered with some international NGOs to advocate and empower young women at the cross section of climate change and neglected tropical diseases, because we, the women, we are the ones who are facing the most burden in this fight. We, the women, are disproportionately affected by NTDs and climate change. So it's really important to empower young women and educate them about the nexus. In the first edition of our project, C.A.N, we've empowered more than 200 women, and we're planning to expand our reach. This project was in USA and Pakistan, and we're planning to expand our reach in the second edition. Next of all, one of the other milestones that we have achieved is we've launched our advocacy book, Climate Action and Neglected Tropical. I'm actually having it right now with me. This is a simple book to advocate young children, school children, in a simple, fun way about cross section, because you know what? It is important to start advocacy from the young level when the brains are actually developing. So we have distributed this book to more than 350 school students across Pakistan. Other than that, one of the major, last but not the least, one of the major milestones that we have achieved is organizing the 1.5 Global Environmental Conference this June on the Environmental Day, 5th June. The conference showcased different panel discussions, innovative sustainable projects from youngsters, international and national experts that all gathered to solve the issue and address this nexus. We have some exciting outcomes and new opportunities from this conference, and I would really like to share this with the Canadian Association as well to explore more collaboration. These are some of the major highlights from our 6 months journey of advocacy through C.A.N 1.5.
Wow, it's great to see how you have empowered those many women. And I agree that youth should also have a understanding from when they are growing up about these very important issues throughout the world. Okay, my next question is for both Aisha and Hooria. So I'm pretty sure, as we all know, that you both do a lot of work on NTDs. So Hooria, how do you promote a learning agenda through your work?
Actually, these issues of neglected tropical diseases, of wash, of climate, are themselves really complex, and their intersection with each other, their interconnectedness, make them even more complicated to understand by the common. If we really want to ensure that what we are trying to share to the people, they actually understand that, we have to make our advocacy really simple and really easy. Throughout my journey, I've deployed several strategies. I've engaged with people from almost all ages, and I've used different strategies in my advocacy, like using statistic data to show people how serious the issue is and showing them numbers. But no, the most impactful, according to me, according to my personal experience, the most effective strategy was storytelling. Look, when we advocate, when we communicate, especially in advocacy, it's vital to craft messages that not only engage but also inspire us. Therefore, I believe that today storytelling is one of the most potential tools that we have in our arsenal. And as a storyteller myself, I've personally witnessed the positive impacts of storytelling in my advocacy. This is due to the fact that storytelling has this ability to connect with people. It transcends beyond boundaries and borders, making complex issues like neglected tropical diseases, like wash, like climate, more simpler and more easier to understand by the common people. One key feature of storytelling is that it is highly adaptive. It can take various forms, whether it's text or photography or music or vocally telling the stories or digital arts. This ability of storytelling actually minimizes the most potential barrier that we have in our advocacy, that is the language barrier. You know what? Art has no language, and when you use storytelling for advocacy, you're actually ensuring that your message is understood by all, and it's actually become really global. So now, if we want to ensure that our message keeps flowing and our efforts are not going to vain, we have to train the next generation of storytellers. Because right now, as we are advocating, there must be a force behind us that can carry the torch forward. So by building on this momentum and by using simpler techniques to advocate for these cross sections that are really complex, we can actually ensure that our messages are more inclusive and that we are actually leaving no one behind.
Thank you so much, Hooria. I agree with you. I also believe that storytelling is a very strong way of communicating important messages everywhere around the world. Moving on to Aisha, your work has been quite research focused, I would say. Can you tell us about knowledge mobilization, bringing communication into the realm of research?
Yeah, absolutely, Ali. That's a great question. I touched on knowledge mobilization very briefly in my presentation, and it's this really critical aspect of translating research into practice. And it involves the activities that really ensure research findings are both accessible and understandable for a wide range of some of the stakeholders that I mentioned also in one of my slides. And often I find it very challenging taking my research and transforming it into communications that are both tailored to diverse audiences and that actually use language very relevant to them. But then I realized that it's not really a one-person job and that this isn't my responsibility alone. It's really a team effort. Knowledge brokers, for example, who act as intermediaries between researchers and stakeholders, can really help to translate and contextualize research findings. As Hooria just beautifully mentioned, storytellers are so important and can help make these our research more relatable and more compelling, to really illustrate the impacts of our research. Those involved in the media, like journalists, podcasters, web designers, they can also enhance our engagement with the community. And speaking of the community as well can and really should be involved in every step of the research process. And that includes at the knowledge mobilization step. And for example, my work in Brazil uses a community-based participatory action research methodology where the participants from the community are involved in the research and are learning with the researchers simultaneously. And so the goal then is to increase public awareness of dengue and also apply that knowledge to create social and political interventions that will ultimately benefit the community. But all this to say, effective knowledge mobilization ensures that research doesn't remain in academic silos, but is actually actively being used to inform decisions. And then by prioritizing communication, the researchers can then maximize the impact of their work and contribute to a more informed society.
Thank you so much, Aisha, for telling us how you bring communication to the realm of research. It's very much appreciated. Okay, thank you both. I will now hand it over to Tina Lines, who will share an action item and will support the audience Q&A. Thank you, everyone.
Thank you so much, everyone. It's been so wonderful to hear about your experiences working with young people and doing all of the NTD work that you're doing. I'm just going to share with you all that the Canadian Network for NTDs will be submitting a written consultation to the Canadian Consultation on Climate Finance. And so we will also include other relevant areas such as NTDs, climate, and health. And you can contribute towards this consultation through the Google form that I've just shared with you in the chat. And this form will be open for responses until June 25th. So if this is an area that you're very interested in and you know a lot about, please do provide some feedback there. I am now going to just look at some questions from the audience. And we did have a question from Dr. Neufeld. I'll read it out. What have you observed to be the most active private sector partners involved in addressing NTDs? If any, and how might they influence or aid the way NTDs are approached? And I'll offer that to both Hooria and Aisha. Maybe Hooria, would you like to respond first?
Can you repeat the question for me?
Tina, you're muted.
It's a two-part question. What have you observed to be the most active private sector partners involved in addressing NTDs, if any? And how might they influence or aid the way NTDs are approached? So it's looking at the private sector partners. So if you've not worked with private sector, maybe you can talk about other partners that you've worked with. If you've worked with private sector partners, this question is for you.
I've actually really worked with the youth organizations in international institutes, not mostly with the private sectors. So I guess Aisha can probably answer.
Thanks so much. This is a very interesting question. I have not directly worked with private sector actors in my research, but they are a big stakeholder in the work that I do, especially with dengue. And I think that I can answer this question on that realm of my research side, knowing that dengue has garnered significant attention from various private sector partners. And they are very instrumental in funding research, particularly in developing new treatments and new vaccines and implementing vector control strategies. So I think that maybe one integral private sector actor with the work that I do is Takeda Pharmaceuticals, which are contributing towards the vaccination campaign in Brazil. Their Q-dengue vaccine is what's being used right now among age groups of 10 years old to 14 years old. And they're trying to upscale that to adult populations in the coming months in Brazil. But like I said earlier, it's a very logistical and administrative challenge. I also think that vector control companies in Brazil are also part of the private sector that might be involved in that, and as well as nonprofit foundations and other philanthropic organizations that might be able to fund the research that I get to do in places like Brazil and places like Pakistan, where dengue is so burdensome. And they really do help with the research and development side of things. I really hope that answers that question.
I think it definitely does. So we have someone here in the chat who says that they would like to add to Aisha's comments that pharmaceutical companies provide support, predominantly donated medicines for LF, onchocerciasis, trachoma, schistosomiasis, and STH. Yes, definitely. There's a lot of partnership within the private sector for NTDs. It's really it's a good global health story and partnership. I'm wondering if the audience has any more questions. You can, I don't think there are any others in the chat. I hope I've not missed any, but you can just raise your hand and unmute yourself if you would like to ask a question. Otherwise, in a few minutes, I'll pass it on to Professor Colleen Davison.
Tina, I think there is a question from Amira Nazir. It's I don't know if Amira wants to speak it or if you can see it in the chat. It's about community engagement and nonprofits.
I can speak it if that's all right.
Great.
Yeah. Hi, thank you both for really great presentations. So we talked a lot about emphasizing the importance of community engagements, having community involved in all aspects of research and storytelling, and even the roles of nonprofit. So beyond that, since you've also interacted with government and policymakers, where do you see their roles in helping tackle NTDs?
Did you want to go for it, Priya?
Yeah. Thank you so much for this question. Yes, obviously, it is tackling neglected tropical diseases, climate change, and all these issues should be a collective approach. Organizations and youth are playing their parts locally, but obviously, if we want to make a greater impact, we have to include policymakers with us. Because they are the ones who will implement solutions on national and international levels. But till now, we are seeing a really big gap because most of the climate change policies don't address health as an integral part. So what we can do is, pressurize, hold our leaders accountable to include these cross sections, engage with them locally, and through active advocacy and through pressurizing them constantly, we can advocate for this cross section.
I just want to add that I agree with everything that Hooria just mentioned. I also want to just say that maybe in the realm of being a researcher, in the realm of science, I think it's also important that we have funding for and supporting researchers for research on neglected tropical diseases. At the very beginning of my presentation, I mentioned that neglected tropical diseases are neglected because there's so little priority in them with the global health agendas, as well as very limited funding that allow for researchers like myself to be able to go out into the field and actually study these neglected tropical diseases. So government funding is very important in that aspect as well.
Thank you indeed. Thank you so much. I think we're going to wrap up our questions for now, and I'm going to pass it on to Colleen Davison. She is the chair of the Canadian Association for Global Health, and she's going to tell us about an upcoming conference. Thank you.
Hi, everyone. Thanks so much. I'm Colleen Davison. I'm the chair of the Canadian Association for Global Health, and we were really happy to be able to co-host this webinar today. We really want to thank the speakers, Hooria and Aisha. Thank you so much for offering your time and your inspiration, really, and all the work that you do. Thank you for that. Thank you also to Ali, our summer intern at CAGH, for helping us to moderate today, and for Tina, member of our board as well, for helping to organize today's event. As Tina mentioned, we are organizing a conference in Vancouver, October 25th to the 27th. That is the annual Canadian Conference for Global Health. This year, it's the 30th anniversary of that conference, and the focus, the theme this year is polycrisis in global health. And we're asking the broad question, how can we improve human health and well-being while protecting the planet? So if you're interested in climate change, health, and neglected tropical diseases, these questions, these topics would certainly be most welcome. Our abstract submission is open now until July 19th. And so you can see how to submit an abstract and more information about registering for the conference, either in person or virtually, on the CAGH website. And so that'll be in the chat in both English and French. I also wanted to recognize our working group for climate change and health. At CAGH, we have a very active group. And if you're interested and not yet part of it, please also check out a link on our website related to the working group. They have monthly meetings or webinars, trainings, and just really work together to be a bit of a coalition towards climate change and health. And finally, I did want to mention that if you're interested in further educational opportunities, there is an upcoming webinar on sexual and reproductive health in adolescents. And so I'm just going to add that to the chat right now. And that is being led by IDRC, one of our partners. So I hope that you might take a look at that and join if you're interested. So thank you again to everyone who's come together for the lunch hour today, at least in Canada. I appreciate your time and all the efforts that we're putting towards this important work. We look forward to having you again at another webinar in the future. And with that, I'll close the session today and wish you a great day, everyone. Thank you.